Hello, welcome to Veritas podcast number 2. We have 2 amazing guests today. We're going to mention a lot of topics, talk about a lot of interesting topics. On my right, there's Madison McCarthy. He is the Chief Medical Officer of the Veritas Health Group and our new addiction program. And Bobby Brazell will be the leader of that program, Director of the Addiction Medicine at Veritas Health Group. And he's going to talk about his vast knowledge in the topic. And we're going to just talk about it, how we can help people overcome their addictions and how we can help as Veritas and what's available out there and what options they have. And before I move on to our conversation, I want to introduce Bobby Brazell. So Bobby, tell us more about yourself, what you do and what you bring to the table in the addiction medicine.
Yeah, thank you, Dr. Hatemi. My name is Bobby Brazell. I'm formerly of Midlands Recovery Center. I am a person in long-term recovery from opioid use disorder, substance use disorder. Coming up on 9 years in recovery. October 19th, 2014 will be my sobriety date. And you know, my passion is just to work with people, and so I've worked with people that have struggled. I've known you for several years now, and we've been working together. And I think we've had multiple conversations about how we can partner together, and now it's finally happening. So we're putting together an addiction consult team and medication-assisted recovery team, and we're going to put together some programs to work with people who are involved in justice-involved people, or people who are involved in the hospital system, and trying to offer them medication such as Vivitrol to get them into a place of recovery. So, and we'll learn some more about Vivitrol as the podcast goes on, I'm sure.
So opioid epidemic is a big problem we are dealing with. It's getting worse and worse. So what do you think is the more increased rates of overdose deaths and injuries are happening compared to 10 years ago or 20 years ago?
Well, I can tell you that the opioid overdose rate has continued to grow steadily and climb since 2014. It has not gone down at all. I mean, it just changed counties. It depends on. Horry County was leading the nation in 2018. It leading the nation overdose, and then moved to Greenville, then it moved to Florence and Charleston County. So it's right on the coast. So our overdose rates are going up. But fortunately for us, our Narcan distribution, our Narcan influx of, with the grant money that's come in through the state, thanks to our partners in DAODIS, we were able to give out last year, we were able to give out Narcan, and the year before that previously. So we're getting more opportunities to get medication out on the streets that'll save lives, such as Narcan and fentanyl testing strips and things like that. There are other people now that are out there doing that, and I think working with Veritas would give us a great opportunity to focus on a lesser known medication that's got a great benefit like Vivitrol. It's not very, very well known. It's not used very often, but I think it has great benefits, and I think it's something that could serve this population very well.
So what's the usage of the fentanyl indicators, the strips? Why people should have access to fentanyl strips?
Oh, absolutely, because fentanyl testing strips can save your life. You can test the medication that you have in front of you, whatever it is that you're using. Our goal is to make sure that people stay alive. I mean, abstinence-based recovery could be your goal, your long-term goal, but we want to do harm reduction. We want to do whatever we can to keep that person alive, so that recovery is possible. Recovery is only possible if you're alive to receive it. So that's where we come in with no shame and no harm and no guilt, no stigma, just meeting the person where they are. And the fentanyl testing strips give them an opportunity to test the drugs that they're using, that they can make sure that they know what they're putting in their body. And we encourage them, if they're using, let the friend know that they're using, have Narcan on hand. That's changed a lot from the old days of abstinence-based recovery completely, In
a segue in that, during the Trump era, one of the parts of the trade deal with China was actually fentanyl, and a lot of people didn't pay attention to that aspect of the agreement, that Trump wanted China to enforce people not to bring fentanyl to this country, and crack down on the import of the fentanyl. I mean, a lot of our fentanyl is coming from China through Mexico, but it originates in China, and anything can be contaminated with fentanyl. I mean, you might buy a narcotic pill or Xanax off the street, and it might be laced with fentanyl, and if it's not done right, it can kill people. So I think fentanyl penetration into the market is a significant
Yes.
reason for the increase in overdose deaths.
Absolutely. Well, and you got a huge party of people that are using straight fentanyl, and then if they're using medications on top of that they're buying off the street, like Xanax, they're pressed pills. We find out later that they're pressed pills. They have fentanyl there. They could have tested for it, so now they've got a daily dose of that already. Two respiratory depressants. So
I think a lot of people don't realize that a very small amount of fentanyl can cause major issues for them, especially if haven't been around it and then end up becoming a little bit sensitive to it.
or if they've been in recovery for a short period of time and maybe they return to use and they try to use at the same level that they were using before. Now you've got a medication like fentanyl introduced in it. That's recipe for disaster.
Madison, you're a paramedic. You were a full-time paramedic before you joined Veritas. Now you're at a part-time capacity. So tell me about like the first time you go to a scene and somebody calls 911 and you're riding the ambulance, and what's your first interaction with an overdose case? Like, how do you evaluate the case? How do you decide it's an overdose, and what you do? What are the steps you follow?
Yeah, so realistically, we go off of presentation and try to assess and fix the most critical issue first. Realistically, although the overdose may be a potential cause, we're obviously trained to identify if there's a respiratory or a cardiogenic failure issue and kind of work on those first. A lot of times people don't use by themselves. Almost every case when you go to, there's a bystander that will tell you that the patient uses, whether it's a family member who's used to them and says they have a history of it, whether it's other users in the same house that just didn't end up with as bad of a disposition as the patient does. And so our first line is to secure airway for the patients, and then once we secure airway and we make sure that there's no allergies or that we have a probable cause that it is a lot of symptomology that surrounds around opiate-based medications or drugs, then we will administer Narcan. And you were starting to talk about Narcan. We're seeing a large push. So originally in pre-hospital settings, we were the only ones who were carrying Narcan. It kind of branched off from there into law enforcement, then started carrying Narcan. Ours is obviously an IV-based Narcan, and then law enforcement now has a nasal spray. And then now, everywhere you turn your head, we're now seeing marketing for people to ascertain it, to keep in their homes in order to use it on their loved ones or other people in order to help reduce that threshold in the time frame between how long it takes for someone from 911 to get to help and assist them. But how easy is it for someone that's not in the medical field to go and ascertain Narcan to keep in their home and help administer it?
Say you have a loved one who might have a drug addiction.
Yes. Fortunately, now it's easier. It's a lot easier to get Narcan than it was several years ago, and that's due to, again, community partners here in Lexington and Columbia, Laredoc, and Courage Center and other places here in Charleston. It's Wake Up Carolina. We've got the Phoenix Center and Laredoc here, Richland, Lexington, that are able to give out Narcan. They're trying to make it more easily accessible to everybody, and this is given out for free. They're giving grants to make sure that people have it in hand. So,
Can you get Narcan without prescription?
Yes, you can. You don't have to have a prescription.
You don't have to have a prescription. So that's very important. Tell us more about Narcan. I mean, some of our people watching this video might not even know what Narcan is. What does Narcan do, and how does it work, and what's the significance of Narcan?
Yes, Narcan is a nasal spray that you spray, and you don't spray it. The person who has overdosed, someone needs to administer it to them. It's 4 milligrams per dose. So you would just shoot the medication into the nostril after you've ascertained that they're not responsive. Once you've done the protocol, they teach you the protocol. That's the important part. When someone comes out to give you Narcan, they actually teach you how to use it. So you learn how to use it. You learn how to put them in recumbent position and make sure that their airway is clear. And you want to make sure that they're breathing. And if not, you want to give them Narcan when it's prepared for. So Narcan is a opioid reversal drug. It attaches itself to the opioid receptors in the brain, and it kicks the opioid off of the receptor. So not only does it save their life, but it can throw you into instant withdrawal. So that's a very key thing to understand. Is that's an important time for that person. If they've gone to the hospital, or been taken to the hospital for an overdose, likely they do not understand what's going on. When they wake up, they have no clue what's happened to them. They've been given a medication. The last time they were awake, they were in their home, in their bed, or in their wherever. Now they're waking up and they're in withdrawals, and they need to have a friendly face and somebody there that can say, hey, this is what we can do for you. And whether that's someone like myself in recovery and intervention is somebody that can work with Veritas and help them move to the next stage of their recovery, getting them involved and getting them in to see the doctor at Hatemi, and he can work with their medical needs. And now they have a primary care physician who can also administer medically assisted treatment and recovery, and I'm there as well, and you're there, and we can offer a very well-rounded service. So,
I mean, addiction is obviously a disease, a problem, social problem that it affects everybody, people from all walks of life. It can be from rich families to poor families, from every single background, every single ethnic group.
Absolutely.
We all can be susceptible to opioid or alcohol addiction. And I guess the first step in that fighting this addiction pandemic is to keep them alive.
Yes.
We don't want people to die because of it. And how we can do it, we can get them to treatment, administer Narcan when we think they're overdosing, or try to eliminate the elements that forces them to get into drug addiction. So what is Vivitrol in this? What is the significance of Vivitrol? How does it work? And why it's a good option to fight addiction?
So Vivitrol is an injectable naltrexone. So you have, like in buprenorphine or Suboxone has two active ingredients. You have the buprenorphine and then you have the naltrexone. Vivitrol is just the naltrexone. So it's like getting a shot of Narcan once a month. So, and the benefit of that is you're making a decision one day that lasts you for 30 days. So I don't have to make a decision to take a medication every day. I just make that decision one day. So it's irreversible once you do it. It has no narcotic qualities whatsoever. So that means there's no withdrawal. There's no weaning off of it. You just take the shot, and then when you're done, you can choose to take it again for another month, or you can choose not to. I myself did it for 4 months in early recovery when I first got out of treatment, and it bought me time for my brain to heal. It bought me time for my mind to settle. So it's basically naltrexone. It's a shot form of naltrexone, and it makes it where you you can take opiates on top of it, but you get no effect from it. So you get no pleasure from wasting your money or wasting your time trying to get a high that you're not going to get. So
it's a slow dispersion over that month.
Right.
It's a depot form, so it's 1 month, it's slowly released. It's like almost like you have some nurse giving you a Narcan shot every single day, but instead of every single day, it's once a month shot, which lasts a month.
Right.
So that makes it easy, it's convenient for the patient. They only need to worry about coming to your office maybe once a month.
And it takes the medication out of the person's hands also that has a problem with taking medications responsibly. I myself have a problem with taking medications responsibly, and I didn't want to have an opiate in my hand to have to choose to whether I wanted to take it responsibly or not, and this takes that away.
And also giving that to patient to come once a month, it creates an opportunity to drug test the patient.
Yes.
So we can catch other drugs they might be using at the same time, which is not addressed by Vivitrol. Also, we can do counseling during that visit, since they're going to get the shot anyways. Let's talk to them about 10, 15 minutes, how they are doing in life, where they stand, and how their addiction is going.
Absolutely.
And there's a lot of opportunity to continue to care, seeing a patient once a month. There's a relationship you're building with the individual. So there's also that element to it. I think Vivitrol is also very popular among judges and law enforcement, because when a judge sees an offender, they say, "Oh, this guy's using drugs." They are more reluctant to go to the other medication that's actually almost substitutes, like methadone or Suboxone or Subutex. They feel like we are trading one evil to another lesser evil, but there's no evil in Vivitrol. It's technically is drug free. There is no addiction issues. We are not replacing something with something bad. We are literally going from drug use to zero use.
Right.
So there's absolutely no use during Vivitrol, which is the powerful part. I think it makes it very attractive for law enforcement, the drug court, even the professional organizations like medical board.
Right.
You have a doctor having a problem with drug addiction and needs to still down to keep the job. We can tell them, okay, this person goes to a treatment with Vivitrol for a year or two. They can keep their license, get back into their productive life. I mean, we want people to go back to their normal lives. We don't want people to be in treatment forever.
Right.
We want them to get back into society and start producing and being a part of it instead of draining the resources, giving back to the community. And I think we can save a lot of lives with Vivitrol in that aspect.
Right.
Is opiate use the only reason to prescribe Vivitrol?
I think there are more uses. Alcohol uses, alcoholism is another
Alcoholism
one.
and opioid use.
I believe there are other indications. They are not yet FDA approved, but I
Right.
think they're in the pipeline. I mean,
Right.
Vivitrol can be. So what are
It's
those?
been, I don't know what those are right now, but it has been approved for opioid and alcohol withdrawal. So, and it's very popular with alcohol withdrawal. I mean, I think it's got a 41% success rate with a small group of people over a 6-month period. So it does work well, and it decreases their. And it's important to realize that to avoid post-acute withdrawal, you need to be off of any medications or alcohol about 7 to 12 days prior to taking the shot. So if not, you'll go into post-acute withdrawal, and that is not fun. Believe me, I've done that myself, and it's not anything fun that you want to do. And it gives you a better chance for success when you do it that way. So it's really good to come out of like a treatment facility or a detox facility and then get the shot, or even a hospital or something like that. And we want to, I know for myself from personal experience, it's not very easy to sit home and detox and then things like that. So we don't want anybody to do that. And, Dr. Hatemi also, he wants to make sure that he takes care of the medical needs of people. So get people in there, make referrals to detox centers where needed, if that's the case. So,
and I think it fits very well with the urgent care model.
Absolutely.
I mean, urgent care model is open late hours until 8 to 8. Mm-hmm. We are open on the weekends, and you don't need any appointments. So we make it as convenient as possible for you to come and get this treatment once a month. And convenience is a huge effect on compliance.
Yes.
You don't need to keep an appointment. You don't need to worry about appointments. You just show up once a month and get your shot done. And I think this program, if we can get a large number of people who has dealing with addiction on Vivitrol, this is a victory. We can make a huge difference on mortality rates and other things that's associated with it. I think we can help the society and drug addiction in a very, very major way. And we hope we can get some support from the drug court judges, the law enforcement, professional organizations to keep their members and keep their patients drug-free. And Vivitrol gives you that opportunity. I think how is the coverage by insurance for Vivitrol?
The coverage for me, whenever I did take it, it covered it 100%. I had Blue Cross Blue Shield, and I know that Medicare and Medicaid covers it, correct?
Yes.
So Medicare and Medicaid does cover it. Most private insurances, I think, do cover it. And we also work with our Vivitrol rep, so that we do have, for some highly motivated people that may or may not have opportunities to receive the shot, we have some samples that we can help them out with here and there. So those are for people that are really motivated and have agreed to work with us and stay in the program.
Yeah, and we'll help. Veritas Health Group will help with trying to get that for the patients.
Absolutely.
Like you said, even if they don't have insurance, we have now a almost 3.5 year relationship with the representatives for Vivitrol, and I know that our staff have been trained to work with them to see if they can get into a program where a certain duration of time is at no cost to them. So
absolutely,
and that's something we love to work with people with is helping them get that help.
Absolutely.
So technically, there's no excuse. They can come and get the treatment. I mean, there's a will, there's a way. I mean, we are making it as convenient as possible. Come get Vivitrol. If you cannot get Vivitrol, we use a free sample on you first time you are and sign you up, so that gets you another month to be able to get your medication squared away. So, but I think the key is to intervene as soon as possible.
Absolutely.
It's like selling a car. Once the patient is willing to do it, you need to move forward, and they're qualified. Just do it right there and then, instead of pushing it to the future. Because the minute they walk out of their room, walk out of your clinic, they can change their mind. They say, you know what, I don't want Vivitrol. But you did want it like 2 hours ago. So you need to catch them when they want it. So if they change their mind, it's too late because it's in their system for a month.
Well, and that's the fact. And so that's the thing, and unfortunately, this is a great opportunity because, some of the other facilities and agencies are just full. They don't have the ability that we have to get people in, within on a walk-in basis. You can't call any other facility and have that same day service. So we can get you in to get your shot and get you in to get your recovery coaching done and talk with your family, and coming soon maybe a pharmacy near you. We're working to get wraparound services and all around well-rounded program.
And I think early recognition is the key. If you identify somebody who's actually dealing with alcohol, the sooner they get treated, the better outcomes.
Absolutely.
Once they're deeper in the hole, the treatment as soon as it starts. The perfect place to capture this audience is law enforcement. Say they have a DUI case or drug-related case, we can plead to the judge or the jury or both that, hey, let's get this person through treatment. If they commit to this treatment and follow the 12-month program, then they don't have to go to jail, or the judge can be more lenient on their punishment. And that's a win-win situation. You rehabilitate some person, they get treated, they get drug-free a year or two, and then the judge is also decreases the backlog, so they don't have to see the same person again for the similar charge, and in more serious circumstances.
Yes, I mean, and unfortunately, this is a perfect opportunity for people who have been justice involved. If someone's been arrested or been taken to county detention center for a drug-related offense, and they're sitting in county jail, or they're sitting there detoxing in jail, and they have no other choice. This is the perfect opportunity. While they're sitting there, we can go there and advocate for that person. Maybe to go, if they go in front and they get their charges dismissed or they plead guilty, we can go and advocate for them to be part of this program. They get released, get their shot, and we can start working with them. They now have a primary care physician, Vivitrol availability, and a recovery coach in-house, and we have services there that can support them in that system.
I hope we can do that. I mean, my dream to have our Vivitrol program 100 to 200 patients strong at any given time. I don't know. Do you think that's a target that's achievable in Lachin County?
I think it's a matter of time. I think it's once people know that the service exists, that it's gonna.
I hope so. I hope so, because we would really like to make a difference. I mean, we deal with the COVID. I think drug addiction kind of went sideways when we so focused on the epidemic that we work about the drug addiction, right?
Yeah.
And I don't think we are very good at capturing. The resources are limited. I don't think we are very good at capturing these people and provide them the services so they don't go back to the drugs, even if after they get treated.
That's right. And we want to go to where the people are too. That's part of my job is to identify areas that are at risk, and go to them and offer this service, because that's, like you said, our goal is to make sure that people are alive to receive recovery. So we're not at the office waiting for people to come see us. We're also out in the community going to them to find what their needs are. So while you're there seeing patients, I'm out in the field and going. I mean,
Vivitrol is not the only solution, or it can be a solution for everything, but at least it's a very significant part of the treatment.
Absolutely.
And it's a clean drug, and minimal side effects. And people, when they take it, they cannot take it. So what are the risks associated for people like taking alcohol, drinking alcohol, or using opioids while they're taking Vivitrol?
Well,
concurrently.
You're not going to be taking opioids while you're taking Vivitrol. I mean, if you do the opioid on top of the Vivitrol, that's one of the dangers. You can still overdose from it. So that's one of the things we want to make sure we educate people on that. Just because there's a blocker there, you don't want to try to overcome those effects by taking so much that you're trying to overcome the effect of the block, because it just doesn't work, and you'll end up going into respiratory distress. So we want to make sure that that's something that we talk with people about. That's one of the biggest dangers that I can see, is just making sure. Then you have, obviously soreness at the injection site, and you have, which is, for me, it's a minor inconvenience as an IV drug user. Soreness at the injection site was probably the least of my concerns. But you have, there's always a chance for history, a chance for liver damage or hepatitis, or that's with a lot of medications though. So
if you take ibuprofen,
I mean, there's, I've seen like explosive diarrhea, depression medication that can cause you to have suicidal thoughts. So stay away from that. But
we've kind of centered really well on Vivitrol, but obviously we know that that's only one component in the recovery process, and your specialty is in a number of different areas that surround in this. Could you talk to us more about the other things that you do to help assist this patient after Vivitrol?
Absolutely. So Vivitrol works well, and but it's, again, you want to add as much to your recovery as possible. So I think working with a recovery coach like myself, I've been working in the field since 2017, working with peers. I'm a trained Arise interventionist, and I work with families to try to help families get into a better place from the person who's suffered from substance use disorder. So I think that's a good benefit to add to the component of Veritas, as being it's a very family-centered and family-focused practice, and I think this goes along with our community. So we offer relapse prevention programs. So I can sit with a loved one and put together a relapse prevention program with them, and what their personal relapse prevention plan is, what their personal goals are for their recovery. Because recovery is not a one-size-fits-all. It's going to be independent, and I'm going to utilize that person as their own resource. They're their own best resource. So use them in that way and help them build their own recovery program, because it will evolve over time. So.
And then how long do you think Vivitrol treatment should be? I mean, there's no literature out there. Like some people say 6 months, some people say 12 months, some people say 2 years. Do you think there's a time period, like a secret sauce or certain period you think works the best, or everybody is different?
I think, honestly, for me, it's everybody's different, and I don't think there's a magic number, and I hesitate to say that, but it takes about 18 months for your brain to repair itself once you stop using substances. Sometimes for methamphetamine, which is 24 months, but for alcohol and opioid use and drugs like that, and benzodiazepines, it takes about 18 months for your brain to repair itself. So with this, it gives you that safety net and gives your brain time that you're not on a narcotic medication, like even Suboxone or methadone. You're not taking a narcotic that's active. You're taking an naltrexone that is just a blocker. So you're not on any kind of drug. You're just basically on a support system that gives your brain time to heal. So I would like to see people on it 6 months to a year, but honestly, it just depends on the person. And again, it's independent, individual care, individualized care. So,
I mean, I wish more people use Vivitrol. I mean, there's so many benefits, how it prevents the relapse and how it can replace the cravings.
Right.
I think there's a huge use for Vivitrol, huge opportunity for using Vivitrol. I think it's the cleanest drug out there to treat addiction medicine.
And that's the benefit of it, is like your brain knows, like when you take the shot, it's almost akin to being, if you've been arrested, you've been locked up and you've been put in a cell, and knowing that you cannot get out. It's the same thing. Your brain kind of just settles on that. Like, you're not going anywhere. So
it's like a point of no return, right?
It gives you
kind
that,
of make that decision.
Right. It gives you that calm that you know that you can't leave, so you're not tunneling out with a spoon, so you just settle in for the night.
Absolutely.
It's the same thing when you get the Vivitrol shot. Your brain kind of understands, okay, I've just taken this commitment for 30 days, so your brain kind of settles in on that, and it gives you that opportunity for that obsession to go away. So now that you can start working on your recovery itself, because it's hard to focus on two things when you're trying to focus on bettering yourself through recovery. Recovery is not just abstinence of drugs. It's actually doing the work and making yourself a better person, working on your life.
Transform your whole lifestyle.
Absolutely. So, and that's what we're offering, give them that quiet in their mind so they can now concentrate on bettering themselves and working their recovery and not just being off of a medication.
And Vivitrol is usually outpatient. I mean, I know they even administer it in the hospitals too, but mostly outpatient. What's the advantage of treating somebody outpatient for drug addiction with Vivitrol compared to in-house, stay in, kind of a drug rehab like rich people in Hollywood goes to? Like, what's the difference between those two, cost-wise, efficiency-wise, quality-wise?
Yeah, I mean, your average stay, even for the very basics for a 30-day stay, or actually a 23-day stay, around 23 days, 24 days, is about $12,000, $10,000 to $12,000 for treatment. And that's at a state facility or somewhere. And it can get up to $74,000, $75,000, up to $120,000 for a month. We're not talking for a year, we're talking for a month. So the Vivitrol shot, the benefit of that is you're gaining, even now, even with our state facilities, opioid use does not constitute inpatient treatment. It doesn't meet medical necessity for inpatient treatment. So they're treating it outpatient along with other drugs that, they're treating that like as outpatient because it doesn't require an inpatient stay mostly. For me, I needed an inpatient stay briefly to get me to that 7-day period to when I could take the Vivitrol shot, or to maybe a 2-week period. And it's just going to depend on each person.
So it should be customized.
Yes,
per patient.
absolutely. I mean, it's not a one-size-fits-all. That's what we have to understand is the way I react to things and deal with medications. You've had patients that 2 medications don't always react the same.
Absolutely.
With the same patient. You know?
They can mix. But I think there's a huge opportunity. I don't think the market offers Vivitrol that easily. I think we have one of the few clinics in Lexington that actually offer Vivitrol.
Yeah, out of the, since I've been working with Veritas and talking to people about Vivitrol, it's shocking to hear how many people, even drug courts, aren't aware of it. They don't really know much about it. If they've heard of it, it's been like a fleeting.
It's almost sad.
It is.
Why you're doing drug court in and out all your life. You're like literally that's all you do, and you don't know one medication that actually prevents that problem. So this shows us how much we are focused on dealing with the problem instead of the solution. And
Right.
we fix the problem and it happens at a great cost when you can actually nip it in the bud, take care of it before it even start and mushroom into a much bigger problem. I think early intervention is the key. I think our target should be like high school kids or even middle school. That's where the addiction starts. The peer pressure. Unfortunately, our school systems are penetrated with drugs.
Absolutely.
Even like our middle school, kindergarten, even not kindergarten, but middle school or high school. It's everywhere. It's cool to use them. People, even young teenagers, have access to it, but they don't know what are the risks behind that. Fentanyl overdose or other stuff that can happen. They just want to feel good at that moment, and they don't want to talk about the future and think about the future. But our job is to remind them that in the future, if you go that route, there's a lot of bad things can happen to you, and you can die because of it.
Well, and I've seen a lot. Unfortunately, I've seen a lot of the kids. I have a son who's 14. He'll be 15, so he's in middle school. He's going to enter into high school as a freshman. So even in his friend group and the surrounding, I see and hear what's going on around them, and they are very aware of what's going on in the drugs and how bad it's gotten and what's safe and what's not safe. And even in their friend groups, they'll talk about medications, or so and so's are selling pills, or they've got these pills, or and they'll know, like, no, nobody can do those kinds of things. You shouldn't do that. And they'll encourage other people, like, you don't do that kind of stuff because, they've heard me talk about it so much, or my son's heard me talk about it a lot. And so he tells people they're stupid if he hears them talking about buying medications like that from people. Yeah. So I think it starts at home. Like, a lot of it starts at home with your own family and your own children, and educating them and not being afraid to have those conversations. Because I'm telling you, my son is 14. I do not want to have those conversations with him. But it's time to have them.
Things we stray away from.
Yes, because
sex, education.
Those
drugs.
Conversations are being had without you.
Right.
Okay, so make sure.
They're going to have them with their peers, and it's ill-informed.
That's exactly right.
And the age average for drug use is going down and down. You have 14 years old, and like you had a case like somebody was like 15? 16
16-year-old
IV drug user. Like, how a 16-year-old even stuck themselves with a needle. But apparently this one was sticking and then shooting up heroin, which is very, very sad. I mean, you went from nothing to that, quite a leap.
Yeah.
So you start using this kind of... So problem is here. We're going to lose a lot of our kids if we don't do something about it. Young people from great families, bright futures, they're going to disappear from the earth because of this drug addiction problem.
Because of access. We have access. We have access right here.
Access
and we need to express some importance here while we're talking about the topic of Narcan and Vivitrol. So for our people at home that are watching right now, we want you to understand that if you think that someone in your home is suffering from an acute overdose, don't put them in the car and try to take them to your primary care provider or even to our urgent care. You need to call 911 immediately and let them professionally assist. If you have Narcan in your home, use the Narcan, still contact 911.
Absolutely.
Most facilities like ours, even though we have the naltrexone, the Vivitrol, and although it is similar to Narcan, we're not the place for the acute overdose portion. We want to be that back end where we're helping to assist in the recovery portion. And so we don't carry the Narcan that you would use in the field or by a pre-hospital provider. So make sure you don't confuse that and then delay care for your loved one by trying to get them to a facility that can't properly manage that care.
Absolutely. And hospital system is treat and release. They are not a rehab facility.
That's right.
They don't do treatment. So, a lot of people don't understand that. They think once their loved one's been taken to the hospital, post overdose, and understand that they treat and release, they stabilize and release, and so that's the benefit also of knowing that this program is out there, so we can
capture those people who are released by the ER or the hospital. Hey, come here, continue your care once a month, get your shot, and then be clear for a year or two. So, and after that, hopefully you won't go back to your regular life. So we are here to rehabilitate people. We are here to back them in society, to become better. And it can happen to anybody. I have seen doctors with drug addictions. I have seen lawyers with drug. I have even seen judges with drug addictions. Drug addiction, nobody is immune to drug addiction. It can happen to any one of us. And we should fight it as a systemic disease. We should fight it as individuals. We will fight them along with our doctors who can help us get medical treatment. Some people worry about the withdrawal. They don't want to get the shot. And my thing is, it's going to work.
Absolutely.
It does work. It's going to work. And it's the hard way to take, hard path to take, because your drugs won't work for you. So you are going from heavy drug users to abstinence of drugs overnight with this medication. But when it works, it's great.
Yeah, it's not something you have to choose. So it's like you said, once you make the decision to get the shot, the injection is good for 30 days. Right. We're not talking about other products like antabuse, where now you're putting that control into someone's hands every single day, where they have to get up in the morning and go, do I drink alcohol or do I take my antabuse?
Right. You can plan your relapse around that if you want. Yeah,
right, absolutely. You can say, well, on Monday, Tuesdays, and Wednesdays, I don't drink alcohol because I take my antabuse. And on Thursdays through the weekend, we have a good time.
I go crazy.
So in this scenario, the Vivitrol is offering a different solution. And once you make that push and get that first injection where it's in your system for the month, I think it probably makes it a little bit easier on the follow-up in the next month to go, I think I want to do that again.
Because the thing that was great for me, and this was the part, is the pride, the pride that you get from maintaining your sobriety for another month. I mean, that's in early recovery, that's a huge thing. And you become proud of what you've gained now, and the more proud you get of that, the more you guard it and the more you protect it. And so I started looking forward to getting the shot, because I knew that, hey, that's going to give me another 30 days worth of myself, for my brain to repair itself, and for me to heal and start working on things that really matter in my life, so that I don't have this other person tapping me on the shoulder every 5 seconds telling me to go do things that I know I shouldn't be doing.
That seems to be one of the biggest problems, is people with a severe addiction to anything. It's not just opiate based. Heroin, methamphetamines is another big one. So crystal meth is now kind of become a prominent issue in this area. And one of the biggest things that they always say is, well, I want to quit using, but while I'm trying to get clean, I can't get my mind wrapped around, and sometimes they'll supplement using other downers like marijuana or opiates, because they state that helps them to prevent from taking the crystal meth, but we're just replacing one addiction with another. And the biggest issue in quite a number of people is they can't get their mind right. They want to do better for their loved ones, they want to do better for themselves, but all those people don't understand that it's sitting in there and it's nagging them constantly, going, you need it, you got to have it, you got to use it.
Well, you have a disease, and that's the thing that we have to understand. And we're moved past willpower here. We're far beyond that. I mean, there are many diseases that you can get that start with a choice. You can choose to smoke cigarettes, and you can get a disease called lung cancer from that. You can get multiple diseases from that. You can choose to have unprotected sex and get HIV, which is a disease that will kill you, and you can choose to do substances and then get substance use disorder, which is the disease that will kill you. So we want people to understand that nobody should die because of a choice. I mean, I made a choice when I was 24 years old to try heroin for the first time, after I had been on pain pills for a very long time. But even people who have legitimate prescriptions for legitimate pain need to understand that chemical dependence and substance use disorder are very, very hand in hand. If you don't believe me that you're not very far removed from a person with substance use disorder, stop taking your medication. And if you start hearing that brain start talking to you, and you start hearing those pill bottles calling to you, and you start feeling sick, you may understand the same feeling that we go through. It's not just about buying it off the street. You can still be dependent on it.
It's a complicated subject. You need to go dive deep into somebody's psyche why they're using it. There are many reasons. People used to forget things. People used to be happy. People, there's a utopian element to it. Like, it takes you away from the worldly belongings and then take you to a different dimension.
Absolutely.
Of course, and so people escape to drugs because it makes them feel good. So you need to take that feel-good part of it out with naltrexone, so they don't feel good. They can take it. It's not going to do jack for them, so they don't want it. Right. That's the main goal. And psychologically, that rewires the brain, so your habit is gone after a while. You know, if you do something for 6 months, 3 months to 6 months to negate something you do, you develop new skills and get rid of the bad skills. Right. For example, if you're used to eat donuts all day long and you start running, you're not going to like it in the beginning, but after you start running, you're going to crave it, and then you don't want the donuts. So I think Narcan gets you in that track that you can have a clean, drug-free life. It's going to be hard in the beginning because you have those, you're going to want it. But after a while, you say you did the right thing and you don't want it.
Absolutely. For the record, I'm going to say, if you ever see me running, you better start running too. I mean, there's something bad wrong. There's something chasing me in the opposite direction.
You know,
that's the running joke in EMS is when you tell your partner, you say, if I'm running, you should probably be ahead of me.
Yeah. I don't have to be fast. I just have to be faster than you.
I mean, doing the right thing, everybody knows it. Like, I don't need to explain to you that the exercise is good for you. You need to go around. Or not eating unhealthy food is bad for you. But everybody knows that. Like, it's not about we don't know. We do know. Mm-hmm. But it's so hard to not do it, you know.
That's another key component for recovery is doing things that make you feel good. Because while you're on substances, your brain has been damaged by these drugs, and it's depleted your brain's ability to develop serotonin, and your pleasures, your dopamine system has been damaged, and so your brain is no longer producing dopamine at normal levels, and so you need to go out and start doing things that you enjoy so that your brain can start producing at normal levels again, and it's not depending on this drug to produce it for them. You know,
I mean, nobody started drugs like, I'm gonna die or I'm gonna have this. They started because it makes them feel good. I mean, you do things, you make you feel good. You eat food that makes you feel good. There's something called food addiction. Sex addiction is one of them, or you are addicted to a lot of watching TV. It's all this dopamine release that it makes you happy. But when we take the happiness out with Vivitrol, and your body will say, oh, I take the drug, I'm still not feeling high, it kind of is a reverse feedback. And your brain is start like, you know what, you associate taking drugs with having no symptoms or having no benefits, so your brain is rewiring itself, so you'll be perfectly drug-free and drug-clear.
That's important to know too. Is once you take away something away from the person, if drug use is tied up in my person and who I am, my very person, who I am to my core over a long period of time. That was true for me after, I'd been at 24. I first started IV drug use, and then I got sober at 44. That was a lot of who I was as a person. Now you have to fill that void with.
I mean, people study addictions. Like, there is so much scientific literature out there about addictions, and they say, okay, you have a bad problem, bad habit. It's not enough to just get rid of from the bad habit. No. You need to replace it with good habits too. So you cannot just don't do something bad and then just don't do anything. You need to actually replace it with better habits. So if you are quitting drugs, maybe you should pick up on gardening or pick up on running or pick up on reading books, the things you were not doing it in the past, but you always wanted to do. You have to replace habits. If it's one bad habit, you need to replace it with a good habit. So it's not that just get rid of it.
And this is about the more things you can stack on your recovery to make it as rigid. You don't build a house with one wall. You build it with 4 walls, and you want to build a solid foundation. So we want to give them access to medication, access to a primary health care physician, access to a recovery coach, access to any number of things like counseling that we can make sure that they receive, and we can. Just give them all kinds of access to recovery programs and their relapse prevention programs, and help them maintain their goals. I mean, early recovery, you come in, you want to conquer the world. I mean, you want to be like, what's your goal? Like, I want to be a neuroscientist. Cool. My job is to find how many goals are within that major goal. Like, do you have a high school diploma? Do you have a GED? Do you have a way to get back and forth? And working with somebody into lessening their goals, and not lessening, but just trying to find goals within goals, so that they don't,
reasonable goals,
so that you don't make an unattainable goal and then you get a case of the F-its. I tried it. I'm not going to try it anymore. That's
well, an environment can be an issue too. So you've got to kind of work with them and figure out what are the triggers or what are the things that may be preventing them from being able to be successful. Sometimes somebody wants to get clean, but unfortunately the circumstance they're in is that they live with other users, and as easy as they want to get clean, maybe they can't afford to find somewhere else to be than other when they're already at. And so it's kind of difficult to list down the number of triggers that may have to be managed in order to help that long-term recovery process.
And I mean, I'm different. Like, I talk about triggers. Like, whenever somebody says the word trigger, it makes me want to twitch. I'm like, there are, we have ways that we deal with things. We have, like, a trigger for me is I need to work on how I deal with, like, if a trigger is true, then I can't use the bathroom in the greater metropolitan area.
Right.
Because I've used the bathrooms to go and do my thing inside of public restrooms. So for me, I just need to have a better way to deal with my feelings and dealing with the underlying issue for why people use substances. That is the key. A lot of people want to know, they think the drugs are the issue, but the drugs are the underlying issue because there's an unresolved problem. There could be trauma, the unrelated trauma, childhood trauma, like big trauma, little trauma. There's things that are going on, but there is a need to medicate that we need to deal with and talk to. And even if they don't talk to me about it, but the person, as long as they understand it and acknowledge that they've got an underlying issue and they deal with that, you start to lose the need to medicate.
And I think the peer pressure and the friends you hang out with has a huge influence on your drug use. If you're around people who already use drugs, you're going to try it eventually and you're going to get addicted to it. If you're in circumstances that drugs are not accepted, then you're going to adjust to it and not use the drug. Right. So environment is very key. And one of my dreams is open an inpatient drug treatment facility overseas, most likely in my own home country of Turkey. And people say, why you want to go all the way there, open a drug rehab center for Americans? Number one is the cost.
Yes.
I mean, we had this conversation yesterday with somebody in this field. Like, he said, the cheapest drug recovery inpatient is $10,000 for about 3 weeks, which is atrocious. I mean, for that kind of money, you can get like a chef, a personal trainer, a doctor around the clock, and much, much, much better and higher level of service. And on top of that, the cost is much cheaper going overseas for treatment. Also, you're away from your family.
Absolutely.
In case of Turkey, you're on the other side of the ocean. So your cousin, Little Willie, who used to give you your drugs, is not around anymore. Or your drug dealer next door neighbor is not there anymore. So you don't have access to your drugs like you used to. Obviously, you need to make a significant effort, and you better learn the language to procure your drugs. But short of that, you're really under surveillance, and they're going to regular drug testing in the hospital. You're in a foreign country. You're going to eat very well. That's for sure. So you might get in a better form. But
well, if they learn Turkish in 4 weeks, I'm going to feel real bad about myself because we've been together for a long time. And I probably don't know enough Turkish to go ascertain something.
But think about it. I mean, you're going to have a private chef cooking for you.
You got to have the right motivation.
But you must have to have it.
I mean, not just like you beat your addiction, you come back with the 6-packs and shining skill, and but get a hair transplant when you're at it, so you look like a Hollywood star, and it's a fraction of a cost, and you have a vacation there overseas. Of course, it's for treatment, but you can.
I mean, we're talking about these things, but these are really goals. These are goals of ours. These are things
you have a loved one. It's going to cost $20,000 a month in the U.S. Hey, give me $5,000. I'll take you to Turkey. Show you the best time and perfect treatment. You get better stuff for 1/4 of quality.
I know for me, I was convinced. I mean, you need to take me to the furthest reaches of Antarctica somewhere, and I would have found the only Eskimo in a igloo somewhere that sold heroin.
You're away from your buddies who get you in this habit in the first place. You're not in the same neighborhood. You're away from everything, and you're actually learning and enjoying the country. And I think that's gonna be a
with support
niche.
and medical help.
Absolutely.
Of course, there will be doctor around the clock, nursing care around the clock. I mean, I'm talking about 5-star treatment, and you get your money's worth, not just like here sloppy work and just stay in a cabin for a month and then pay us $10,000. I don't think it's fair. I don't think it's feasible. I don't think many people can afford that. I know people will scramble and sell their goods and houses and assets to send the loved one to these facilities. But it's a huge burden on the family. I mean, who wants to spend $70,000 to get a family out of addiction? I mean, they do.
Well, they probably already have court costs that they're
Well,
battling with. They
and
probably
that's the
have
thing.
So
medication costs. There's so many other things that.
Legal costs, court costs. I
Yeah.
mean, yeah.
Let's just start stacking them on. So
medical
then,
costs.
how easy is it for us to want to get help if we know that it's going to cost us an arm and leg to do it?
Well, that's the thing. You just invest. And I talk with clients and patients all the time, and just I encourage family members, if you're going to if you're going to help your loved one, invest in their recovery. Do not invest in the continuation of their use. I mean, invest in their recovery, invest in moving them forward in whatever that manner that is. And that's something we can also offer and help with, is working with the families to try to get them in that place. I mean, I'm an interventionist. I work with families by design. That's it's kind of where I'm at, and help teach and educate. I'm speaking in MUSC in Charleston for pharmacology students there on the 24th this month. So next week, I'm looking forward to that. So a lot of education, a lot of reducing stigma. That's the topic of the discussion. Working with the pharmacies and pharmacology, the pharmacists there. I have a personal story with a pharmacist. Doctors can be very important to recovery. That's Dr. Hatemi he's my personal doctor. That's why, because he's somebody I trust as a person in recovery. After just going through hip replacement surgery and a hernia surgery last year or a year before, having a doctor I can trust that knows my status, I mean, that's very important. So I'm just excited about it.
So you need to break the barriers for access.
Yeah,
so you need to break the barriers. What are the barriers? The timing. No appointments. Come anytime. Make it convenient. Extended hours. Extended weekends hours. Come on a Saturday if you don't have time otherwise.
I can arrange like transportation for people who are in need.
We will even drive for you. I mean, you tell us where you are, we pick you up. I mean, we will deliver it. We will remove all the excuses so that you can get the proper care, and that's what matters. We are not rigid like other entities, government agencies. We can make things happen.
Absolutely.
Much faster, much better, and in a much desirable fashion, and breaking the habits. Taking people overseas sometimes to take this kind of treatments. I mean, there's so many opportunities.
Yes.
I mean, just so many things you can do for people at a fraction of a cost. It's just ridiculous.
Well, the good news is Veritas has very knowledgeable staff that are in office every single day, Monday through Sunday. And even if it's not Lachin that's there, we have several other providers that are going to be very well versed in helping to assist in this need. And so we just want people to know that you can come in 7 days a week, and we'll be more than happy to assist with that and facilitate it for you.
And if you have any questions about the topic or anything we talked about, just ask the question in the comment section, and we will get back to you, and we'll respond as much as we can.
Absolutely.
So do not hesitate to subscribe to our service. Also, ask us questions in the comment section. We will definitely read it, and we will respond to you as we have time. So don't hesitate to interact with us. Ask us our questions. We are here for you. We are in this journey together. We want to make a drug-free society. I don't know it's feasible, but we're going to come as close as possible to
Absolutely.
a drug-free society.
We want to do as much as we can in our community to help end overdose and senseless death, and just help better the community and just offer the service. So anybody that needs to find out more about this program, they can call Veritas and ask for me, or they can get in touch with me directly.
I mean, the burden on the society is incredible. I mean, think about how many car wrecks happen because of alcohol use, or how many bad decisions made because of drug use. How many people died?
Yes, absolutely.
I mean, how many people get very serious health problems because of drug? They survive, but their health valves are all clogged up because of the IV drug use, or they have other health problems, hepatitis C or other stuff. They got bloodborne pathogens. So we need to actually treat the patient and get them back. And there's a lot of treatment. Hepatitis C, we can cure hepatitis C.
Yes, now you can.
For heart problems, we can put a new intravascular heart valve. So we can do a lot of interventions to prolong your life once you're ready to go to that journey to quit the drugs. There's a huge opportunity there. I think there's an unaddressed need.
Yes.
I don't think there's enough facilities out there providing care in such fashion. Not as friendly or rigid. They are very rigid. I mean, you cannot make an appointment just to go see them. Like, you have to wait for a week or two to go to see them. And sometimes the week and two can make the huge difference because they might change their mind.
Yes.
They don't want to go to recovery after a
And
month.
for a family that's been damaged by substance use over a period of time, I mean, this is a great way to earn trust back. I mean, you agree to take a shot that's going to last you 30 days. I mean, that's a commitment. That's showing your loved one that you're dedicated to, at least for a month. Like, I'm going to make a decision that's going to last me 30 days. And I always encourage our patients and their families to meet effort with effort. If they are making this effort to get this shot for 30 days, and you make this effort with them and continue that going. So that's very important to know.
It takes a village, you know.
Yes,
It's
absolutely.
your friend, families, your colleagues, your coworkers, your doctors, your professionals, your counselor. Everybody needs to come together to work on that, so minimize the temptation to get drugs on board, you know.
Absolutely.
And that one small step at a time, I think we can achieve that level by actually teaching people what are the causes or consequences of using a drug, and what it can do to your body, what it can do to your mind, what it can do to your skin even.
Yes.
You know, you age prematurely, you don't look as good. I mean, there's nothing glorious about that. I mean, people try to spend a lot of money just to look good, and you're using a medication that will make you look sick. And also the social aspect. How many traffic accidents happen because of drunk drivers? And how many people die because of these accidents, also drunk drivers? And you can take care of the niche market with the naltrexone, and it will never become a problem again. So as the people who are providing other services, I mean, Narcan is gold.
Yes, and it's important to show that recovery is possible, and that, you know, the benefits of recovery, and that there's happiness to be had in recovery, and that taking the medication or the substances out of your life is not the end of your life; it's actually the beginning of your life and your newfound life in recovery.
So if you want to quit
we're excited
alcohol
about
and
that.
drugs, just come to Veritas, and we will help you get on the Vivitrol shot.
Absolutely.
We're going to provide it with no appointments needed. Just come drug-free for 7 to 14 days
Yes.
before the injection. And we are not here to judge you. We are not here to haze you. We are not here to help you.
Absolutely.
So we'll be very non-judgmental. There's no reason to be shy about it. This problem affects everybody. So it's not just you. So, and you're not alone. It's a health problem. It's a healthcare problem, and we will solve it with healthcare.
Absolutely.
And there's nothing wrong with that. You recognizing your mistakes and take actions to fix it. There's nothing more glorious or better than that in the world. You know, it's more of a self-reflection.
I really hope that everybody's enjoying our podcast, and I just want to remind you that if you're looking for our information, we're very easy to find. You can find us at www.veritasurgentcare.com. We hope that you will subscribe and like our posts, and that will be on Facebook, iTunes, Spotify, and YouTube. And also just remember, when you get in touch with us, you'll be able to get information about Bobby Brazell's items that he's able to offer and assist with your families, and the other things that we can do with the Vivitrol. I really want to say thank you a lot, Bobby,
absolutely.
for being
Thank
here
you,
with
man.
us today and going over this. I know this is a touchy topic sometimes for some, but I'm glad we were able to be a little more open about it today.
Absolutely. Absolutely.
Our society cannot progress if we not address the touchy subjects, because touchy subjects is where our problems lay, and we need to solve them. So, you know, we need to approach everything in a pragmatic, scientific fashion, not in a political standpoint, because science is what matters. Science doesn't care about your affiliations. Science doesn't care about your religion. Science cares about science, the facts, the truth, the God's creation. So we are here to actually have this happen and make your journey through recovery as painless as possible.
Absolutely.
Thank you, everyone.
Thank you.